Today's video, how to spot fake pharma grade gear.
Welcome to this channel. If you want to learn more about the most cutting-edge science-based information in the world of hormone optimization, please subscribe and hit that notification bell.
Hello everyone, welcome to the TRT and Hormone Optimization YouTube channel. I'm Danny Bossa, joined today by a faceless anonymous guest who's going to shortly introduce himself in a limited way. The topic today is how to spot fake counterfeit pharma grade, pharmaceutical grade gear. There are a lot of people in different parts of the world that have a very hard time finding legit doctors for TRT or sometimes of the add-ons that people are using along with TRT, and are sometimes kind of almost obligated to get their stuff online, and they oftentimes do get pharma grade gear. And there are tons and tons of fakes, counterfeits out there. The guest I have on today, I'm going to actually let him explain. He's got a vast experience on this subject and is going to basically demonstrate what legit pharma grade gear will look like, things to look for in the fakes as well, and just go through these examples he's going to prepare. So Mr. Anonymous, you want to share your a little bit about who you are?
And before I get into my introduction, this is such a frustrating thing, because a lot of guys, for example, in your group, who do want to add something, maybe they can't get enough testosterone, maybe they want to try proviron, maybe they want to try growth hormone. A lot of them are going to see the most expensive option, see it's pharmaceutical grade, and they're going to go for that because that's what they feel most comfortable putting in their body, when in a lot of cases it may just be a counterfeit product. And and later in the video we can talk about some safer options, but basically I'll go into my introduction. I am an athlete, not a bodybuilder, but I'm in a sport that requires a lot of power, a lot of speed, and I do have experience traveling abroad. I have bought many things over the counter before. I have met many people overseas that can provide things. I have quite a stash of my own stuff here, nothing like a bodybuilder would. But, as we know, all athletes use performance-enhancing drugs to a degree. It just depends on the kind of training that's needed in that sport and the kind of recovery that's needed. I am on TRT. I do work with a doctor as well, but I am one of those guys that definitely requires more than the average 200 milligrams a week, because I'm one of those guys. You could split 200 milligrams any which way. I'm not getting my levels over like 600 if I'm lucky. So there's not really many doctors around that are going to be willing to write more than that. So I always have my own stash of testosterone. Maybe I have some growth hormone. I might use it at about 2 units a day to heal from injuries. That's really what I see out of it at that dose, is really just injury healing. It'll keep you a little leaner. You won't really put on a lot of muscle and strength with that. That's not going to happen. So anyway, let's get to it. I contacted Danny thinking that it'd be a good idea to get some of this information out there, because a friend of mine gave me some proviron and asked me to take a look. Here it is. That's Bare Proviron, name brand. Okay. We'll open it up. Here you got your paperwork, right?
Mm-hmm.
Everything looks official. All blistered up. I was able to tell in under 1 minute that these were completely fake. And this happens with a lot of products, so I'll explain why. This product is written in Turkish. In the country of Turkey, there's a lot of anabolics that are available over the counter. You can get Sustanon, Primobolan from Bayer. You can get Proviron. You can get Anadrol 50, also, chemically known as oxymethylone, Anapolone brand. So there's quite a bit there. I mean, it's like Mexico for the US, but times 10 and much better quality. But unfortunately, there's a lot of scamming going on in that part of the world. So what Turkey does, they take a drastic measure, or fairly drastic measure, because it's definitely not foolproof, as I'll show you, that they put this code on the box. It's a QR code, okay? You can scan that on your phone by downloading an app called ITS, capital ITS, and then the word mobile, MOBIL. There's no E. So write that down, and that way, guys, in case you ever get a product from Turkey, you could scan it to validate it.
This is specifically for Turkish gear, is that it?
This is all for Turkish gear, but you'll know Turkish gear because the language will be in Turkish language.
Right.
And they have all the growth hormone in Turkey too, all the pens and stuff like the Norditropin, the Sizen, the Humatrope, all that stuff, and I'll show some of that. I'll show some of that later in the video. So this QR code, it's right here out in the open. Anybody could see it. Anybody could duplicate it. Anybody can copy it. So these fakes, they'll scan in your hand and they'll show you what you have in your hand. You know how I know it's fake though?
How?
I have 4 boxes here, right? They all have the exact same serial number. I don't know if you can see, but there's a parentheses with the letter 21.
It's a little fuzzy. Try to pull it out from your phone just a little bit. It's not quite focusing, but I'll have to take your word for it.
Well, anyway, just remember the numbers 21 in parentheses, okay?
Okay.
That is the serial number of all these products. They should all have different serial numbers. This here is Sustanon 250 from Aspen, okay? See, the QR code is on the sticker. And I have multiple, right? So if you look at the 21, where the serial is, all those serial numbers are totally different on these Sustanons. On these Provirons, all these 21 codes are exactly the same.
And when you're saying 21 codes, just because we couldn't see it, are you talking about a number that precedes the 21 or follows the 21?
You'll see it. You'll see the numbers 21 in parentheses, and then there'll be a number afterwards. It's like maybe 10 numbers. I'm not sure exactly, but probably like 10 numbers or so. And if you have, that's why you need to get multiple products. See, they get away with this because somebody might buy an Eli Lilly Humatrope growth hormone, which is like 72 IUs, and it's pretty expensive. So somebody might only buy one kit. If they only have one kit, they're never going to be able to tell unless they had 2 boxes. If they had 2 boxes and your serial numbers were different from each other, you can know that you have a real product if it's scanning out on that app. But if you have 2 or 3, like my friend had like 4 or 5, the guy must have spent like $1,500 on this. And they all had the exact same serial numbers. And he actually took them. He did use them, and then he went and he got his blood work done, and his IGF was like, I don't know, it was like 115 or something. If you were taking this guy was doing he was doing a good amount of this stuff before he got the blood test. So I mean, he should have been like 400 or 500 easy. So any questions about that? I'm going to show you a couple. I have a couple of real products here too. Like this is Norditropin, right?
Mm-hmm.
I mean, this is what is this? This is a 15 milligrams, so it's like 45 IUs. These have stickers, so the codes are like stickers on there.
Mm-hmm.
And the 21s are different. I bet you if they were fake, I bet you these codes wouldn't be stuck on with they'd probably be just like printed on the box.
If they were fake?
If they were fake, I think, in my opinion, if they were fake, I think that these codes would just be like just printed on the box, just like the regular labeling.
Okay.
That's what I think. mean, that's what I've seen. Because a lot of guys are buying some of these pens and things thinking that they're getting real good quality, and they're paying a lot of money because for somebody to make one of these, if they make a humatrope pen, a fake humatrope, for example, they could sell that thing for like $400 because it's like 72 IUs.
Mm-hmm.
These Provirons, I think when I scanned it on the thing, you know, it gives the price of what it is in Turkey, and I think it says something like 19 lira. I don't know. I'm not really like an expert on their currency, but that's literally like, I think it's like $4 or $5 for a real one in the pharmacy. So God knows what they paid for these fake ones, right? And you'll see they'll charge like, you know, they'll charge like $35, $40 for these little boxes, and all it is it's only 20 tablets of 25 megs a piece. This would last you like 10 days.
Gotcha. So guys will be buying up boxes and boxes of this stuff because Proviron is, I mean, at the end of the day, is a fairly mild compound to add to
Yeah, and a
your
lot.
tea. So it'll
Yeah,
be like, you know, is it doing something? Is it not doing something? And after maybe a couple months in and they realize it isn't, they've now spent like a pretty penny for
exactly.
it.
And the bare Proviron isn't on the black market. It's really not cheap. In the pharmacy, it's dirt cheap. If you're in Greece or something, or you're in Turkey, or you're in like ex-Soviet country or somewhere, like that, you could buy this stuff. It's cheap, like $4 or $5 for a box. You could probably take them out of the boxes and stuff like 100 of those blisters probably in your socks. Take them home. I don't think anybody would even notice it, to be honest. Let's see here. Over the scan codes. You know, if you are going to buy something, you are going to be looking for something like Proviron, or even just any other compounds, for example. Maybe it could be Masteron or Primobolan or Decadorablin. You're probably better off trying to source one of these. Like, there's a lot of companies out there. Like, I have one, for example. Like, this is Alpha Pharma, right? It's a pretty famous brand. They're out of India, and it comes with like a see their codes. Like, it comes with like a scratch. You can scratch it off and check it on the website. So that really can't be faked because it's not like these codes here, for example, that are just out in the open for a faker to get a hold of, right? And there's other brands out there. Like, I mean, I'm not going to name a bunch of brands, but like, I'll just name, like, I know Alpha Pharma has a license, I think, in their country. I think like Balkan Pharmaceuticals has one, like Moldova, you know, country like that. You know, there's a lot of companies like this though, and they basically produce in good environments because they're made in places where they might do some contract manufacturing of all sorts of drugs for all sorts of companies, and the rules are very lax in that particular country, and the raw materials are very available, that more than likely you're probably going to get a pretty good product. And these companies, like, for example, this company, they've been around for many, many years. They're really not likely to make a product that's not dosed up to par.
Gotcha.
And you know, you have at least some safety here, at least with the security codes. You can look for the types of companies that produce, you know, they're producing maybe the orals are coming in blisters. Maybe they have an option for both vials and ampules for the injectables. Those are kind of more or less your larger scale type labs that produce in a legitimate facility, at least, you know, somewhere in Asia, probably China or India. Eastern Europe comes to mind. I think that's a safer option, especially with some of these other, you know, exotic type compounds. If you want to have some extra testosterone in your drawer, you want to have some Proviron, you want to have a little Deca, because, you know, unless some of if you're working with a clinic maybe, or you're in a place in Florida, they'll probably give you Deca without a problem. But if you're just doing some TRT with your internist or your local doctor, you know, maybe they're all cool. Maybe they're giving you, you know, whatever, shot a week, 200 mgs, whatever. They probably don't even, you know, some of these guys, they probably don't even know what Deca is, you know. So you'd probably be better off just buying it on your own, even if you do get it from a compounding place, I know Deca, they charge you pretty good from some of those places, and I know Oxandrolone, I know forget it. If you got it from a
Mm-hmm.
compounding place, you're looking at
Mm-hmm.
like probably $10-12 a day to do Oxandrolone, right?
Yep. Yep.
Yeah.
So the blister thing you're saying, if they do sell them in blisters in these container, in the little packages like you're showing, versus just getting a little vial that you open up and all the pills are just in that vial.
Yeah. So
If
those
you're seeing
are
signs
what.
of them putting more effort into the packaging and more effort into that, it's a sign that it could be a little bit more legit.
Well, at least it was made in at least in that case, it's made in a place that produces pharmaceuticals as opposed to like a homebrew type of operation. I don't really feel comfortable. I feel like there's three options when it comes to buying your gear, right? So like at the lowest, I think you have like, I know in America, I mean, a lot of guys use this stuff. It's probably dosed okay, but maybe it is, maybe it isn't. I just don't know about sterility wise though. It's these guys that are making it in their house. And then a lot of times these guys are putting so much alcohol in there that it's going to like bust your ass and they'll be like inflamed for 3 days. I mean, you don't want to try it. You don't want to do anything like that. And then on a whole other of the spectrum is like trying to look for something that's pharmaceutical grade. But like I said, in Europe especially, there's there's some countries that you can buy things, right? So a lot of products from Turkey are legit, but they'll also have fakes all the same. Bulgaria is next to Turkey, right? You can buy gear. I've been to Bulgaria, and you can buy gear there. You can buy Omnidrin, which is like a Sustanon mix, one of the best testosterones you can get. You can buy Retabolil, which is a decadurabolin. It's like a 50 milligram deca ampule. I think they got Proviron. But you can buy those things legitimately there. Like if you lived in that country, you can go walk in a pharmacy. I don't think you need a prescription. Pretty sure you don't. And you could buy those things. But you know what they also do in that country? They also produce like almost all the fake human grade gear. So it can get confusing where the same places that have a legit supply also have all the illegitimate supply as well. So it can get very, very, very confusing. And I've been doing this a long time, and I just happen to gather this information over the years. And a lot of guys really don't even know this. Like this little thing with the Turkish scan code, like a lot of bodybuilders and stuff, they do know about it. Like some of them know about it. Some of them do. But then they don't know that this thing could even be faked as well. I would say if maybe 30% of the guys who buying gear know about this thing, maybe less than 2% of them, that 30% know about that they could fake the little scan code or how they fake it with that 21 number as I spoke to earlier.
Right. And you were mentioning offline also that same scan code could sometimes be used on a number of different products.
Well,
is that what I understood?
They have to take it from the same type of product, because when you scan it, if I scan this Sustanon right here, okay, if I scan this code, it's going to tell me, it's going to say Sustanon 250 ampule. It's going to say the batch number. It's going to say the price. It's going to say the expiration date. So it's got to be from the same product. So if they want to do humotropes, they need to get a real humotrope in their hand and get that code off the real humotrope. They might make 10,000 of them after that. But they're all going to have that same serial number that was on the original humotrope box that they started with.
And you've never seen any fakes where they actually found a way to put varying serial numbers on each box?
Not with this Turkish stuff, no.
Okay.
I think the only way that would happen is if a company had, like some of these labs I was talking about, like some of these like for export only type, like this brand, or let's see, what else do I have here? Here's like another brand that's pretty good, and on the back, like, see, there's a scratch code.
Mm-hmm.
That's very well protected because you can't see it and you can't tamper with it.
Right.
If the company had some kind of code or some kind of like feature, but it was open that somebody could see it, it's not hidden,
Hmm.
then I believe any product like that, if it's popular, I think it's there's a very good chance it can get faked.
Well, you also got to think of the fact, I mean, logically, if it's covered with something, a scratchy, you're going to scratch it off eventually and you reveal the goodness underneath, and you
Yeah.
can just copy that and start plastering that on something else. And
Well,
so,
a lot of those places though, they'll if you go type in the code, it'll say how many times it was checked
okay.
on the website. So it's going to give you a warning if it was already checked. So
Gotcha. Okay.
that is quite a help. It's definitely better than buying something that's open for somebody to counterfeit.
So are there different apps for different countries that produce this stuff, or like this
To be
IP specific?
honest, I think Turkey's the only one that I've seen as a country to do that. Um, they have a website. I can't even think of it off the top of my head, but they do have a website too, where like most countries do, where you can actually like look up and see like what they have in pharmacies and how much they cost. Because in a lot of these countries, the cost will be the same from pharmacy to pharmacy. Like it'll be like mandated, I guess, through the government. Um, I know Turkey has one. Like Greece has one. I think it's called like galinos.gr. So by knowing actually the real prices for things, that helps too. Because if you see that they're selling, I don't know, a Pfizer genotropin pen in that country and it costs, I don't know, say, I don't know, $140, let's say, I don't know, depends on the size or whatever. And there's a source online and he's selling it for $155. Like, why would the guy be selling that pen and only making a $15 profit? Like, obviously it's
Right.
big. You know, I saw a pen. I think it was a Pfizer pen, and it looked like it had some like Indian writing on it or something. Like it was maybe from one of their pharmacies, and it had a price on the box, like in their currency, and you saw what the source was selling it for. And then I went and typed in that currency, and the difference between what the source was selling it for and the currency on the box was only like $3.
Right.
I know in some of these countries, like I know in like Russia, Turkey, some of these places, you could buy like a 30 IU Norditropin pen over the counter for probably like, I don't know, low 100s. That's like what a person selling it would, if you were to buy it yourself, or if you bought it from somebody who bought it there, that's probably what they would pay for it. And so then like you got to figure you'd probably pay close to double. But I mean, in America, if you had a prescription for 30 IUs of Norditropin or Omnitropin, it probably cost you $1,000 a month.
Yeah. But I wonder if in these countries, like you're saying, one of them only had a difference of $3. Like if the guy's selling it, making a $3 profit, but he's selling 100 of them a day, and in that country, $300 a
No,
day is like
come on.
you're like
I
rich.
don't. Nobody.
you know?
I don't think these guys get in the game to make $3. And
Right.
plus, something like Pfizer, something like a pen of growth hormone, they're not going to make $3 on. They're going to make $3 on. They want to make $3 on a single, like this single ampule of Sustanon. They'll even make more than that on, because I mean, I probably might have paid. I don't know. I'd probably pay if I bought this from somebody on the black market. It'd probably be like $10, $11, where they're probably buying them for like $5. So this is one single amp in one single box. So the, it's going to be at least. I mean, they're going to make $5 off one guy's shot of testosterone. You think they're going to make $3 off of one guy's growth hormone pen that's going to last them a couple of weeks? I doubt it.
Yeah. Gotcha.
And these guys that are in this game, they're trying to make money. I mean, there's obviously some risks involved for them, and there's connections that they need to have in order to get these things, probably in mass amounts.
Got it.
Like I said, and then with growth hormone, probably the safe options. If you can get something. If I was going to buy pharmaceutical growth hormone, meaning FDA approved, it's going to be Norditropin, Omnitropin, Sizin, Humatrope, like one of those. Probably the best bet. I would only buy it if it was probably from probably from Turkey, because at least you have that scan code and you know right away if the scan code is legit from what I just explained, because that's how they fake them. A safe option would probably be like something, like everybody talks about China and growth hormone. So China makes a lot of generics and things like that, but they also have they have two brands out there. They have Gintropin. I'm sure you've heard of Gintropin from Gene Science, very famous brand. That's FDA approved in a few countries, and you could buy that in a pharmacy in a few countries actually. So if you can find that, it does have a pretty good verification system. I would look for Gintropin that's sold in Russian Cyrillic writing. That's your best shot at getting a legit one, because the ones that are in Chinese don't usually circulate out of China. There's also a brand called Ansimone from Anki Bio. They have a pretty good verification system too, and they make legit medicines as well. And that's a pretty good one. And they're a lot more cost effective than like some of these Norditropins and stuff. Like you could probably get 100 IUs of a kit like that for give or take around like $300-$400, as opposed to like if you got something like this on the black market, it's probably going to be like $250 for like 45 IUs. You could probably get double for the same price. And I think that brands like that, you'd be pretty safe. I think you'd be pretty happy with the quality, and at least you know like where it came from. That's definitely better than buying like those blank unlabeled vials from China, because you don't know what they're sending, because it could be like GHRP6. You don't know, because they're sending you blank vials.
Right.
At least if you have Gintropin and they make from Gene Science and they make Gintropin and they're giving you a box that has a pretty good verification system, you could be at least pretty sure about it.
Now, what do you do if you got, you ordered a bunch of GH and then you get it and you purposely ordered a number of kits so you can check them against the serial numbers and so on and so forth. So now you bought, 2, 3, 4 kits. You get them, you realize they're all fake.
Well, then you got to
money. I mean,
contact the supplier who gave them to you. He'll if he's a good guy, he'll take them back. He'll take them back from you. He'll refund you. He'll help you out. If he's a scumbag, a lot of these sources are on on forums and like online places. If you went and exposed them on one of those things, you'd probably ruin their reputation.
Yeah. But then the same guy could just pop up on a different name and a different.
Because let me ask you, Danny, if you wanted to buy some growth hormone, for example, and you were looking at some options, and you saw a good source that maybe you wanted to order from, you'd probably check him out online, right? Mm-hmm. Like his reviews on a forum, maybe. And if you saw that people were getting jerked around with fake GH and whatever, you'd probably run scared. You wouldn't buy it.
Yeah.
You wouldn't chance it.
Yeah, but even even the because I've gone into tons of forums to look up all this stuff tons of times, and even the ones that are, you have a 90% success rate, you always have the 10%, like, oh, I got it, it was fake, and I had it tested, it was no good, and I checked my blood levels, it was no good, and blah, blah, blah. And so, even a lot of these reviews, sometimes I just look at them, sometimes it's like Amazon reviews, you get a product and there's like,
listen, some of those
their
reviews,
mother that wouldn't give it 5 stars.
Some of those reviews are, they, could be even fake reviews too. But, generally it's most of the time, it's like guys really just trying to help each other out with making good buys and things.
Yeah.
And who's trustworthy and who's not. Another good option is testing your gear. So some of these things that I've gotten over the years, I have tested it. There's I don't know if I should say you think I should say like a place where you can get it tested, but there's some places like around the world, like in Europe, for example, you could send off a sample. You could send it blank in like a little clear bottle with a cap.
I don't see any issue saying places that you can get tested.
Yeah,
I've heard of a bunch of them.
I used a place called Janoschik.
Okay.
Janoschik. and they're in Europe. He's pretty good. I mean, I sent him one time like 5 separate samples in these little like auto sampler bottles. He had no idea what they were supposed to be. I just had labeled at my house so I would know when the results came back. And this guy was spot on everything. Everything was exactly what it was supposed to be.
Right.
All within, all within label range.
Have you ever had anything tested where it tested not what you expected, and if
I have only done this a handful of times. I would say I'm 5 for 6.
And what was it the 6th time that it wasn't what it was? Like, what did it want?
I'll tell you.
How did it wind up being tested?
Well, I'll tell you what was good and what was bad. What was good was I had a couple of products from some of these labs that I just showed you now. Some of these like export labs. That stuff was all good. I tested, for example, some of the Sustanon 250. That was good. That was real. I tested Omnidron 250 from a couple of different countries, and that was all good. The one that came back fake was a testosterone depot ampule from a company called Eiffel Fango, which is a German brand, like a pharmaceutical German one. And I had no idea. Actually, the guy, even the source, really had no idea that it was fake. But it had like 90 megs of SIP in it. I mean, he didn't even know either. And we tested it, and that's what happened.
So it was testosterone, it was SIP and not depot.
Yeah, but it was only like 90 megs. It was supposed to be an ampule, 250 milligram ampule. And I should have known, I should have known better, knowing that, like in Germany, getting testosterone in Germany is like getting testosterone in the USA. It's not like you just walk in and go buy it.
Right.
It's not like these Sustanons, like Aspen is, it's all over Europe, right? We've heard of Aspen Sustanon, but Turkey, I would say, is the only like legit place you're going to go and buy it. Like, you can't go to like Stephen's country in Belgium and just go buy that over the counter. It's not going to happen, even though it's the same thing. It's probably a totally different price and everything. Like Omnidron, for example, is produced in, they still produce it in Poland. So it's an EU country, but it's sold all over it's sold in Eastern Europe. It's sold in Central Asia. It's sold in, parts of the former Soviet Union. And I would say, like, there's some countries that you would need a prescription for it, and there's some countries you don't need a prescription for it. So it could be fairly, a better chance of you getting real ones. Again, with those, usually the fake ones have stickers that look like shit, and usually the expirations and the batch numbers are kind of crooked on them, so you kind of tell. I'm trying to think, what else did I get tested? Yeah, I think that was everything that I gotten tested. I think I've gotten like 6 samples tested. So
you mentioned also offline when we started talking about the thyroid related stuff.
Oh yeah,
guys are worrying about that.
Yeah, so I have autoimmune thyroid disease. I need thyroid. I've been on thyroid for many years, and there's always a worry, like, because if you can't get tested, like, what if you lose your doctor? What if you lose your job? What if you lose your insurance? Getting tested really isn't a big deal, but for some of us who are on these T3, T4 combinations, it's a little, it's definitely harder. Like, I think your average guy who is on one of these products really probably has no idea where to go and get a replacement if shit hits the fan in that regard. They probably know where to get tests, whether it's good test or bad test. I mean, but they probably know where to get it. They probably, when it comes to the thyroid, they probably have not a friggin' clue. I would say that, let me see, do I have it in front of me? Okay, whatever, I know the name brands. So if we're talking natural desiccated thyroid, and then T3, which is a T3, T4 mix, we all know, or those of us who at least take thyroid and pay attention to thyroid. And then there's synthetic T3, T4 mixes as well. Those will also suffice. And then you have your general T3, and then you have your just straight up T4, which I don't really recommend. So in Thailand, they have a couple of brands, which you could find if you Google, if you know these name brands, you can Google them and you could find them. It's very inexpensive. You can get a tub of 1,000 1-grain pills. So those of us who take like Armor know what a grain is. So like I'm on 2 grains of thyroid, which is 120 milligrams of that stuff. So I'd require 2 of those pills. That's called Thyroid-S. And they have another brand, I believe, is called Thyroid. It's spelled, but with an I instead of a Y. They might even have another brand or two that's popped up in the recent years, but I'm not really sure. But those 2 are the main. And you can get 1,000 of those probably for like $150.
Oh, wow.
Yeah. So, I mean, you get one of those bottles and you take 2 grains a day, you got a year and a half of thyroid for like $150. Very cheap. Let's see. In Turkey, they have a product by the company called Abdi Ibrahim. It's the same company that makes the Anapolone, Anadrol 50. It's called Bitiron, Bitiron. And I believe maybe it's like 50 T4 and 12.5 T3 per tablet. It's usually 4-to-1 ratio is usually what you're looking for in these mixes. Again, you would want to follow the rules with the codes. They even make a T3 product too. I think they call it Tyromel, but I don't take T3 by itself. So, but I'm pretty sure that's what it's called. Merck makes a product that's widely available through Europe. You could definitely find it online. I found it a few times, and they call it Novothyral, 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 and that's a T3 T4 mix. I think that's 100 T4 and 25 T3, I believe.
Okay.
So that's what I know as far as for the international market. As far as T3, T4 combinations, I would stick to those. I would stick to all those brands are pretty reliable, and you can get them fairly cheap. And I think that would be a help to all the guys that use thyroid and want to have a little extra thyroid, especially in times like this. Who knows if like the pharmacy's going to run out? Like there's been times that I've stocked up on it just because I know that there was a shortage on either Armor or Nature Throid or some of these other ones that are, generics that are produced.
I've had to do it twice so far for testosterone. I renew my prescription online with my pharmacy. They call me up half hour later, like, yeah, there's a shortage. We don't have any. We're probably going to get some next month or the month after. And I'm like, what? Like, you don't have it? Like, no. And so can you transfer my prescription to like a different pharmacy that might have some? And they're like, no, because it's a controlled substance, we can't transfer your prescription to a different pharmacy. You'd have to go through your doctor. He'd have to write a prescription, and then you'd fill it at a different pharmacy, and then we'd cancel the one here. And I'm like, Jesus Christ, I would just go online and just order a bunch of vials, and I've got them. And I'm like, if I can't get my prescription, I have this stuff. Like maybe it's not as good, but at least it's something.
I recommend to a lot of guys listening, just, find something that's trusted or you like and buy 5 vials and have them. Mm-hmm. If you could buy 5 vials, I'm sure you'll get a decent deal on them. You buy like a number like that and just hoard them away or use them or whatever. Yeah. Like in Canada, you guys get Enantate, like Deltestrel up there, right?
Yep.
Usually.
That's my prescription. Yeah. Enantate.
Is that the only testosterone they have up there?
I don't know if it's the only one. It's the only one that I've had since I started my prescription. It's the only one I've ever tried. It's the only one they ever gave me. I don't even know is there cypionate. I've been reading lately that cypionate might be a little bit better than Enantate for a number of reasons. I don't know how much those reasons are actually, how
I don't know.
It is.
I mean, I could argue and think cypionate. I mean, Enantate's bad. Listen, for me, I like Sustanon. Some guys don't. Some guys do. I love it. But like I just know in Canada, like here, obviously cypionate is what's usually prescribed. So I know in Canada, I know Enantate usually is what prescribed, but we can get Enantate if we want it. Is it the same for you? Do you guys have that option to get cypionate as well?
I'm not sure. Never asked.
Yeah,
I've never asked. It really does. It does blow my mind though that I could walk into a corner store right now and go buy 10 cartons of cigarettes and tell the cashier, I'm going to go home and smoke all of these in one sitting. He's like, all right, go ahead. and it's fine. Or I can go to the liquor store and buy 20 bottles of vodka and tell the cashier, like, I'm going to go home and drink these 20 bottles of vodka until I die. And they're, all right. Like, no one's going to stop me. But if it's like, I want to take some growth hormone because I'm 46 and I'm seeing symptoms of crappy growth hormone production and no doctor wants to prescribe me this because, oh no, heaven forbid we give you growth hormone, which is insane.
You know
I gotta
what's
go
funny?
jump through all these hoops to get it illegally to improve my health, but all the shit that I can take to destroy my health, the soft drinks and the processed foods and the sugar and the this and all this bullshit,
You
I
know
can go
what's
buy
funny?
that stuff as much as I want. I can't grasp that principle. I just can't.
In some of these countries, testosterone you don't need a prescription for, but then say like something like decadravelin you do, for example.
Mm-hmm.
And like I said, in Turkey, if you go on that website that I was telling you about where you can look up the prices and things, they classify the primobolan, the anadrol, and the stuff like that under like like anabolic steroids. And the testosterone isn't classified with that. It's like classified as like like endocrine hormones or something like that.
Right.
Like a totally different classification. But obviously in North America, they don't really want people to be feeling good and feeling healthy. They want to, and they want you to keep coming back. Like if you come there with a symptom, they're not really trying to fix you. They're trying to get you a little better, but still feel a little off. So you keep coming back. And that way it takes like 4, 5, 6 times for you to, be satisfied and probably still not be all that satisfied.
Mm-hmm.
So they can actually make some money on you.
Yeah, it's crazy. I actually had a talk with scheduled with Rick Collins. Maybe you heard of. He's like
Yeah, of course.
one of the leading lawyers in the world for this type of stuff. And he was going to explain why it is that all of this stuff is criminalized and controlled and how it all started and the events that took place that made this happen. And I was supposed to do the talk with him just a couple of days ago, or I think actually it was a week ago, but he canceled it with all this stuff going on, just as many others have.
Yeah, I think a lot of it.
Yeah.
I think a lot of it seemed to have started after like after the Olympics in '88. I think.
Yeah, with the Ben Johnson.
Yeah.
The Ben Johnson fiasco.
With Ben Johnson, the
Yeah.
Bar Lewis type stuff, and then I think Joe Biden was involved. And what happened, I believe, is a lot of countries just followed suit later on.
Mm-hmm.
That's why things are all over the place and across the world, because you could be in, say, certain countries in Europe and they're just as strict as the US. And then there's other countries in the world that are even worse. Like some of these poor guys that live in like Australia or something, for example.
Yeah, that's like they're completely shit out of luck over there. It's unreal.
The US, you can get away. I think in the US, to be honest, I mean, if you got the right doctor, you can kind of get away with a decent amount. You can get, some tested DECA or some tested Anavar from the doctor.
With the right doctor, but how many of those right doctors are there for the entire continental US?
Exactly, there's not that many. But I'm saying, at least it can be done. And it's I don't think it's too hard to get a. Thing is, it's really not. I feel like it's at a point. It's really not hard to get a prescription for testosterone. I just don't think that there's many people who know how to administer and prescribe it the right way.
Right.
And I really think that there needs to be more talk about dosing and body weight with testosterone, because I just feel like a lot of guys. I feel like the 200 mgs may be good. And I'm not saying this is the only reason why some guys might get a high test level out of 200 mgs versus a guy who doesn't. But I think a good reason could be body weight, because I know a lot of guys who are like 160 pounds, 170 pounds, who could take 200 mgs a week, and they could get their levels up pretty good. And I know a lot of guys that could take 200 mgs a week and get not so great levels. And a lot of times they're usually bigger guys. But like I said, that's not always the case, because I do know some other guys that aren't that big of guys that just don't get a huge level out of that. I think certain guys just they just use it differently. Like myself, I need about 250 every 5 days just to just be in the just where I need to be.
Right.
If I do, And the reason I do that, the 250 every 5 days, is because I actually get a pretty good peak in the level for a few days. And then by the time the fifth day comes, I'm probably testing around 1250 or so. That's like my trough. So to me, that feels pretty good. If I'm doing the little small shots across the week, for me, for my body just uses it too fast and it never actually sees any kind of peak.
Right. Do you have your SHBG on the higher side a little bit by any chance, or?
Probably like
Because I
25,
always
30.
see guys 25, 30.
Yeah. I'll tell
Okay.
you this, as far as free test, I've pretty much calculated over the years, for every 100 points of testosterone, I usually get, in a serum, I usually get 2.5 free.
Okay.
So if that puts you at, if you're at 1,000, that puts you at about 25, 1,200, put you at 30. So if I'm dropping to like, 1,250, 1,300 as like my minimum, then like that puts me in like that low 30s. And then probably at my peaks, I'm probably like, mid 40s, maybe up to 50. So
Right.
I guess that's like decent, it's a decent place to stay.
Mm.
I feel pretty good there. So
Sorry. With me, I've tried the that kind of technique. Let me just do the twice a week. It'll have a peak and whatever. And I every day I feel different. Every day is a different day. I got great libido. I got no libido. Oh, look, I got this. Now it's just, there's no consistency. My SHBG is always between 18 and 20. So I attribute it to, maybe it could be having to do something like that. But
yeah, so what are you getting? Like, do you know what a free looks like for you? Say if you got a blood test and you were like 12, 1,300, what would your free look like?
At 250 a week, which is my prescription, my free T sits at 28 doing daily shots.
Okay.
And my total is at 1068 last time I checked. Yeah.
Okay.
Which isn't a lot. People say, "Oh, it's a cycle." Like, no, it's
No,
not. It's just,
I hate, I can't stand that. So I need about 350 a week just to get the numbers I just spoke about. But if you're taking 150 a week to get the same thing, I guess you're just a better man than me. I don't know. You're all of a sudden, morally better.
I would need your dose to get those numbers you're talking about.
Yeah,
to say when you're
exactly,
at 40s at your peak, I'd probably need something like 350 a week.
Yeah, maybe
around there.
To be honest, maybe I really might need about every 4.5 days. I might need that. What does help, if I get my hands on Sustanon, I do like Sustanon for me, because it kind of, for me, not saying for everybody, I'm just saying my experience and blood work, it works as advertised, basically. You know why? Because I feel like if I did the same 250 with Cypionate, I feel like I would use it faster, and by the fifth day, I think I would be lower than that number I mentioned.
So it's the longer ester that you're enjoying, is what you're saying?
Yes, because you got the prop and the phenylprop and the Sustanon, which hits you fast, which any shot is going to hit you fast, no matter what, if it's anodate, whatever. Then it's got the third ester, which is kind of like a Cypionate, I guess. And then there's 100 mgs of it is that long decanoate ester. And that long decanoate ester, I feel like keeps like a certain base, at least. So I don't drop below a certain number as long as I'm taking my shots. Because obviously we should be more concerned about our bottom trough number. That's why all these studies that are always done on testosterone levels and effects of certain doses are always done testing the trough, because that's really what's important. We don't want to go below a certain amount. So
yeah, at the end of the day, you gotta experiment and find what works for you. There's some guys that they're better on twice a week. They try daily and they're like, no, I feel way better on twice a week. Do that. Some guys twice a week. I can't do twice a week. I got to do at least, 3 times a week at the bare minimum. Twice a week just won't work. I've tried it over and over, because I'd love to be lazy and not inject so often, but it is what it is. It's how my body reacts. So,
Yeah, if I had a Cypionate or an anandate, there's been times that I've tried, I'd say, I don't know, like 100 mgs every other day. That works okay. I think for me, the Sustanon works best every 5 days. I think that for me, that combination of esters, like I said, I feel like it works the way that they intended it to be designed. But I'm sure, because everybody's so different that it's not going to work like that for everyone.
Mm-hmm.
But if you want to argue, it is probably the most commonly used form of replacement across the world.
Oh yeah,
It's got
absolutely.
some sort of reason for that, I guess. I don't know. Either,
Absolutely.
Sustanon, whether it's Sustanon or Omidron, they're the same component, the same mix, basically,
Mm-hmm.
depending on the country you're in.
Got it. Anything we didn't touch on, Mr. Anonymous? Or
I went over everything that I wanted to go over. Anything you have to add I'm open to it.
I'm pretty good, I think. I don't really have much. I think we pretty much covered everything.
Okay.
So this was great. It was a long time coming. We've been talking for a while, so it was great to finally
I
meet
just
you.
hope some
Yes,
of these guys could, at least use some of this information, because I have noticed over the years that, like, as people are starting to learn about this stuff, I think some of these sources they're quitting carrying some of these products. Like, I remember up until like a year or two ago, I was still seeing on like certain websites or source lists that they would carry like Organon Sustanon. Organon hasn't been around in like 10 years.
right.
Like Aspen's got the labeling to make Sustanon now, not Organon. And I would see, you could even see Organon Pregnil out there. People faking HCG. Like, come on, man, you got to fake HCG? That stuff's cheap.
Yeah.
So
I need
I've
to
seen
make a
some
buck.
places stop carrying some of that stuff. So hopefully, with more awareness, um, keeps the scammers away. They'll scam other
Absolutely.
things. Find something else. Maybe make pocketbooks or something instead. I don't know.
All right.
Stay away from
Thank
false
you.
stuff. We gotta inject this stuff.
Yeah. Thanks very much for your time. It was
Sure.
great. And guys, if you like this video, like it. If you didn't, dislike it. Click, subscribe, notification bell, all that stuff. Sorry, my brain is like just off with all this stuff going on lately. I'm in low
Not
gear.
alone.
And enjoy the rest of your day.
All right. Have a good one, Danny. Thank you.